Hello, 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 everyone, and welcome to another edition of Healthy Happy Hour. I am Joseph Ward, your host, and first I want to say thank you and a big shout out to our team director, Mr. Matthias Sweet, for all the contributions that he's given to the Neighborhood Medical Center and to this podcast. He's going to be joining us soon, but also give a big thank you and a shout out to our CEO, Ms. Janae Freeman, for the support that she's given us and our podcast platforms over the past year and a half now. Um, of course, you know, this Healthy Happy Hour, this is what we do once a month in Healthy Happy Hour. We use this to make sure we connect our community members with the resources and the people in our community who can help our community members get the resources they need, get the health care they need, get the health information they need, or any other information that they need. We just try to use our platforms to the best of our abilities to make sure that the people in our community don't go without. Um, Remember, our Healthy Happy Hour happens every third Thursday of every month. So this will be our Healthy Happy Hour for this month. So thank you for joining us. And as I said, Matthias will be joining us soon. So this week on Healthy Happy Hour, we have Dr. Amit Jan. And Dr. Jain is a board certified medical oncologist and hematologist at Tallahassee Memorial Healthcare. He earned his medical degree from All India Institute of Medical Science in New Delhi, India, before completing residency at the University of Iowa and fellowship at Indiana University School of Medicine. Dr. Jan practices at TMH Physicians Partners, Cancer and Hematology, and is board certified in medical oncology and hematology. Dr. Jan chose to become a physician because he felt it was one of the most humane professions in which he could positively affect many lives. So, once again, well, I'd like to welcome everybody in the virtual world. Put your hands together for Dr. Amit Jan. Thank you, thank you, thank you for being here with us.
Of course, thank you, Mr. Ward. Thank you for the very nice introduction. So I'm really happy and honored to be here. As you said, I practice hematology and medical oncology at Tallahassee Memorial Healthcare since 2012. So I've been here in Tallahassee almost 10 years. And, Breast Cancer Awareness Month, as we know,
Hmm.
October has been Breast Cancer Awareness Month. You'll see all the pink decoration, and people have their placards in their yards these days.
Yes.
And just a couple of years ago, we were doing all sorts of races and runs and galas to raise money, for all the women who are, some men who have gone through or going through breast cancer diagnosis, treatment. And as one can imagine, getting a phone call about there is something wrong in the mammogram is never a very pleasant conversation for everyone
Hmm.
to go through. But before we even get into that, I mean, the key thing with breast cancer and many other cancers is screening. As we know, cancer caught early is always easier to treat and easier to remove and can have a lot better outcome in the long run.
Hmm.
So there is a screening protocols. There is mammography that is offered at Tallahassee Memorial Hospital and at many other facilities in town. And even women who sometimes feel they do not have a payer source or they're underinsured or uninsured, there are a lot of different sources and facilities available that we help them in getting their mammograms done.
Okay.
So the key thing is, of course, to encourage women, aware them that breast cancer can affect anybody and everybody. Statistically, one in almost 8 women in the United States will have breast cancer at some point in her life. So that's pretty huge numbers. We're
Right.
talking hundreds of thousands of women diagnosed every year with breast cancer. The breast cancer used to be a death sentence a few decades ago, and we have come long ways in treating breast cancer. The surgeries used to be catastrophic, and women will have scars they will carry all throughout their lives. And we have improvised on that. And with modern technology, we're able to catch cancers that are so small that one cannot even feel them with their naked hands.
Right.
And for the mammography, ultrasound, MRI, other such X-rays investigations come in place to catch mammograms before catch a breast cancer before it's too big. Some women have strong family histories, their mothers or sister, aunts, grandmothers with breast cancer. We encourage them to talk to their primary care providers. And we definitely have the neighborhood medical center and facilities that encourage those women to get screened. Once they do have a screening mammogram, then if there is something that's discovered by the radiologist, that leads to the next step. So there's a little process in there. Of course, the first thing is to talk to their doctor or meet
Right.
with the provider and get the mammogram done. Next step is usually to wait for the results. So there's a little bit of a week to 10 days, sometimes waiting period to get the results. Nobody wants to get that phone call, but if they do get a call saying something was not looking right, something looked different, then sometimes they're called back to get some more pictures taken. So there's not a diagnosis made at that time. There's still investigations ongoing. There are some mammograms and some women have abnormal findings in the mammogram, but not everything turns into a breast cancer. So I don't like women to always worry. Every abnormal mammogram means bad news,
Right.
but certainly it does need to be followed through and not get afraid and scared. There is cancer navigation services available at Tallahassee Memorial and other places that can help guide the women to what the next step is and what should they do. So usually, if there is an abnormal mammogram, that second step leads to getting some more dedicated pictures to the area where there was an abnormality. And if there is still confirmation that there is something abnormal, then a biopsy is often recommended. So it's a needle biopsy, often done by the radiologist themselves. And women are
Right.
brought to their mammography place. And it's an outpatient procedure. So it's basically getting a small sample from the area of abnormality to see if this is cancer or not. At that point, if the diagnosis is made, then the biopsy slides are referred over to a pathologist. So there's a whole team of doctors that are involved in getting to the diagnosis and treatment. Once the pathologist reviews those slides under the microscope, they label it as if there was cancer or no cancer. And then a referral is usually made to a surgeon or to a medical oncologist like myself.
Okay.
We have a good long talk with those women. We have them come to our cancer center. We talked about what this diagnosis means, what are the treatment options, and what can we expect. So there's definitely this a few days to a few weeks of a learning process and getting to the point of knowing that woman has breast cancer. It's definitely a very scary time for all women. And, like I said earlier, we have a lot of resources to help guide those women. What do we do from here and how we're going to approach that? Breast cancer is not one disease anymore. We have such advanced research and technology and new science that distinguishes different kinds of breast cancer. Some breast cancers can be very easily treated with a simple surgery called lumpectomy, in which they do not have a lot of cosmetic disfigurement, oftentimes done outpatient, and they're able to resume their normal activities sometimes within 3 to 5 days. Some women require radiation treatments after their surgeries, some women do not. So everybody's treatment protocol is very different and can be dependent on the age of the women, the stage of the cancer. We certainly treat everybody the same. It does not matter their socioeconomic background or their insurance status. We give our treatment plan. And again, we work with them in terms of how things are get paid. All women are afraid we're going to lose, work and time, and how are things going to get reimbursed. But there are resources to help women. And I always encourage women to at least seek those resources rather than shy away from it.
Yes. So I have a question, and just to make sure I understand as far as the screening process. So for the actual screening of breast cancer, and because you mentioned taking the pictures, and the pictures are taken during the mammogram.
Correct. Correct.
Okay. And so is is that the primary way of screening, or are there other ways of screening that would happen once a woman come in? Um, let's say if she has no idea, she's just doing a regular screening. Are there other ways, or if something is found, because you mentioned the biopsy, so that will be further testing that will be um,
Correct.
that you
Well,
would use.
right. For most women, a mammogram is the most common screening tool in
Okay.
the United States. In countries outside of the United States where the mammograms are not readily available, there are more crude methods like self-examination of the breast by women. So that's something they are taught from earlier ages to just always look for a lump, when you're taking a shower once a month to feel for anything that feels abnormal. And also when they go see their primary doctors, they get examination done. So there's this physical examination method of screening also, but a lot of breast cancers can be missed on that. And like
Right.
a mammogram's advantage is it catches a cancer before it can become palpable, before it can be felt by the woman or her doctor. So for 99% of the cases, mammogram, it's called as screening mammograms, and there's several different kinds of them. There's some digital, there's 3D, there's pros and cons and different advantages, but screening mammogram is usually the most common method in the United States to screen for breast cancers.
Okay. All right. That makes sense.
So, and for most women, currently the guidelines say age 40 and above, they should start doing a screening mammography or mammogram unless they have a very strong family history. Like I mentioned, if they had an immediate female in their family, mother, daughter, sister had breast cancer, then they may even have to start it even earlier than the age of 40. Now, there's also some rare genetic diseases in which a gene is passed from family to family, and those women are at a very high risk for breast cancer. And you might have heard of the famous story of Angelina Jolie from Hollywood. She found, made that very well-known. Bless her heart, that she knew before she was diagnosed with cancer
Mm-hmm.
that as a gene from her family that increases her risk of breast cancer as high as 60-70%. So that's almost odds are that she was going to get breast cancer at some point in her life. So those women have to have a discussion with the genetics people. There is a geneticist and genetic counseling to understand one's risk.
Right.
For most women, they have average risk, which is about 1 in 8 to 1 in 10. So except those cases, we do the mammographic screening and the biopsy, like I said, and diagnosis, and then talking about different treatment options. So again, the most common surgery for breast cancer that used to be a complete removal of the breast,
Mm-hmm.
that mastectomy. It's a very drastic surgery. Women have a big scar. There is a lot of long-term issues. There is always this stigma of not having a breast for women, and we have come long ways, from that to do smaller surgeries that are just as efficient, that keeps the breast cancer risk still low for future. So, what treatments they're going to need, not all women will need the mastectomy. Some can spare and do a much smaller surgery. What we do here at the medical oncology, we treat breast cancers with medicine. So after the women have met through the surgeons, they meet with sometimes radiation doctors, and then they are referred over to one of the medical oncologists like myself. And we talked about different treatment options depending on, again, each individual woman's stage of the cancer or age. And there are chemotherapy medicines that are out there that are needed
Mm-hmm.
for women. There are anti-estrogen hormonal medicines that are pills, not one bookcase, followed for all women. So everybody's case is very different. We definitely want to, encourage younger women, and women of color tend to have a higher risk of more aggressive cancer. So there have been studies saying Black women and Hispanic women at the same ages tend to have more aggressive cancers. At the same ages of 45, Caucasian women and Black women may have a more aggressive cancer. So it's something that we're just learning about, and that is, really including all women, to make sure that they get their mammographic screening done, and make sure they stay on top of it. So a mammogram's often done once a year. So
Yes.
yeah, remind them for their when their mammogram is due, and they just need to go make an appointment, go get their mammogram done. It's a simple procedure. There are no needles involved. It's pretty much like taking an X-ray, but X-rays of the breast, and it is a little bit uncomfortable. As men, we have not gone through and experienced that, but all
Right.
women who've gone through it will tell you that it's a little bit discomfort for hopefully saving their lives and keeping them alive for a long time for them and for their family members. So, starting with the mammogram screening, doing the biopsies if required, and 1 in 8 women will have it. That means that many other women will not have it. But, again, we encourage all of them to continue to do their mammograms at least until the age of 70 or 75. And cancers can be caught in different ages. The most common age that we see breast cancers is in the 60s. So it's less common in the younger ages or very older ages, but that's an age that we see most commonly.
Okay.
Briefly talking about men can get breast cancer too. That risk is only 1 in 100. It's a much smaller risk. There is not routine mammogram recommended because the risk is low, but men should be aware of any lump in their chest, and they definitely should get that evaluated as well. And again, men who have females in their family, so their mother or sister or daughter, if they were diagnosed with breast cancer, they are at a higher risk family and a higher
Okay.
risk. So that's the screening process is the most critical and crucial because you cannot diagnose breast cancer until you do the screening.
Right.
So encouraging women in the community and awareing the purpose of the breast cancer awareness, as the key word is awareness, to tell all women everybody is at risk and everybody should get tested, just like they've talked about, for COVID vaccines and infections. You may have better immunity or less immunity, but nobody can be spared. Everybody has somebody in their family that's been affected by this one way or the other. And you know watching a good healthy diet, doing physical fitness and exercise, all those things are helpful in keeping women healthy. We are not very aware of a lot of things women can do early on. So a lot of
Mm-hmm.
times the question, what can I do to keep my breast cancer risk low? And there is no particular medicine or diet strategy or exercise strategy that has really proven that it will reduce a woman's risk of breast cancer ever in their lifetime. The key is
Right.
to do the testing, the screening, and catch it at an early stage.
Gotcha.
And
Yes.
our cancer center, we have both medical oncology, radiation oncology, who do radiation treatments for the breast cancers, and we have a surgery team. We all work together. So we meet with the woman, we make sure all of her questions are answered. We have our social worker team and cancer navigation
That's
services
good.
help navigate to the system. It can be very scary, very upsetting to get a diagnosis of breast cancer. But I want the women in the community to know that we're here for them. It's not just to raise awareness and put a pink tutu on and dance around alone. We actually are there. We want to help. We want to make sure whatever services you need, we're happy to work with you and with their schedule, so they can continue to function and do their day-to-day living, continue with their employment and taking care of their children and so forth.
Yeah. So I have a question. Because you mentioned 1 in 8 women will have breast cancer in their lifetime. So during the time that breast cancer has been studied and treated, has that number of 1 in 8 has that is that like a progression because of the amount of breast cancer that is being found now? Or within this time of being able to find breast cancer, have you noticed that number to increase or decrease over time?
Well, it's kind of a complex question. So before the mammograms were done routinely, we were finding breast cancers at higher stages, but less in number, because there
Okay.
are women that have a small breast cancer that even if you never find it, they may live a normal life and never feel it. So
Hmm.
for a women with more aggressive or bigger breast cancers, that has decreased significantly. But that certainly does mean that we are catching somebody at the age of say 75 a small breast cancer, that she may never have known and may have lived normal life without ever knowing about it. So
Right.
there's the pros and cons of saving the women who would have died from breast cancer. That number has significantly gone down, but there is a little truth to that, that the number of women diagnosed with breast cancer has gone up since we're doing the mammogram. So we're catching them more. And there is certain women that may not ever need the mammogram, but it's very hard to tell in the community who is okay not to be screened and who does. So there is certainly increase in number of mammograms. So there's increase in number of breast cancers that we have seen.
Okay. All right. That makes sense.
So I mean, breast cancer. Currently, if the breast cancer is caught in an early stage, like a stage 1, even a stage 2 breast cancer, what it usually means, so different stages of breast cancer is depending on the size of the tumor, whether the cancer has spread to any parts of the body, whether it has spread to the lymph nodes or not. So most commonly, we are catching breast cancers at stage 1, early stages. So those women, after all the appropriate treatments, have an excellent outcomes, and more than 90% of them live a normal life, 10 years or longer, breast cancer free. So, different stages of breast cancer, catching them early also means we can assure them that there is a very good chance that they're going to be breast cancer free and living 10, 20 years, or maybe even a normal lifetime. And something else may get them, but not breast cancer. And that's kind of with the staging of breast cancer. So a lot of women ask us about, if they have breast cancer, can they get it again? So most certainly, actually, some women who have one breast cancer are still at an increased risk for a future breast cancer. So
Hmm.
even having one breast cancer surgery does not mean they stop their mammograms. We recommend they continue to do their mammogram even more diligently. So, year after year, year after year. And definitely letting their family members, their daughters, sisters, or also know if they had breast cancer. It's a good thing to share with the family members. People are scared because, again, there is a stigma. So I do want to take that myth out that all breast cancers are going to be bad and they're going to cause a big scar, or women will always remember that most of our women with early cancers, they forget they ever had cancer. 5 years later, 10 years later, I mean, it's in the back of their mind. I'm sure they never forget something like that happening to them, but they go on to live on their normal business and back to being functional members in the society. And places like you guys as a neighborhood medical center, a bond clinic, even the Department of Health, they're crucial in encouraging those women to get their screening done, get their testing done. That's I want to thank you guys and the neighborhood medical center who brings up a lot of women who are otherwise underprivileged and don't have the health insurance and the means to get their mammograms done. They bring those women to encourage them to do their testing, catch them, and catch it before it's too late. Like we said, in all the cancers, catching it before it's too late to getting the mammogram screening is the most vital thing. Raising money and funds is still not sufficient if we cannot encourage women and people in general to follow and be comfortable with getting that done. In places outside the United States, there is still a big stigma about breast cancer for the same reason. The women will not get a testing done and they wait too late, and then they do need a bigger surgery. So that's still somewhere, set in mind of some women who have seen that, 10, 20, 30 years ago. And again, we've come long ways from that, doing way better in testing them, guiding them, encouraging them, and, sharing with them that they're going to be fine. We're going to be here to take care of them. We have a team of people, and the oncologist guiding them step by step what is the right thing to do, and give them the options to choose so they can make the right choices for them.
Um, from a layman's person standpoint, trying to understand the advancements in the surgeries, because what we normally see are the pictures of the women with the full mastectomies for either one breast or even both breasts with the scars, and that's the normal messaging we see. And this is coming, like I said, from a layman's person, not necessarily doing a lot of research into the surgery of breast cancer, but you're talking about an advancement. So just make sure I'm understanding the full mastectomies don't have to happen. They have different they have different surgeries that they can go in and remove the cancers without removing the breast.
That's absolutely right. So, like I said, back in the olden days, mastectomy was the only way. But now with this, on the mammogram, MRIs, we can pinpoint the location of the tumor, and majority of the women are able to avoid a full mastectomy. Actually, only a small percentage of women still require to have a full mastectomy, and surgeons will sit down and talk with them. There might be a little bit of disfigurement. There might be a little bit, of course, a scar tissue. There is
Hmm.
done, but for most women, it's cosmetically very trivial, not very noticeable. I would say three-quarters of the women are able to spare a big surgery like a mastectomy, and they do what we call as lumpectomy, which is, like you said, taking the tumor out and a little bit margins around it, sometimes called breast conservation treatment. So you preserving the breast and the anatomy and the structure of it, and just taking the lump out with a very fine precision. The radiologist who finds the tumor and does the biopsy will often leave a little metal clip. So that helps the surgeon, when they're operating, identify where the tumor is located. And then they just can remove, sometimes as small thing, a golf ball size, or something even smaller size surgery is done.
Okay, that's that's great. And because I know the advancements in technology just overall that are happening, and we are somewhat aware of. Well, we've learned that, I guess, the diversity in the surgeries that are used, but not necessarily the in-depth information regarding the mastectomies and now with the lumpectomies. Because I've heard people talk about lumpectomies, but didn't necessarily know exactly what they were talking about. And I was just trying to use context cues, so I knew, okay, a lump, they're taking out a lump, but with the specific pinpointing up and then leaving the tag, that's a brilliant advancement. So it makes it a lot easier. And
And
so are you? So would you be a part of the persons who will be leaving the tag for the surgeons?
yes, that's the radiologist. That's the doctor who's
Okay.
reviewing pictures of the mammogram, and they do the biopsy. So to help the surgeon guide the treatment, they leave that little metal clip in, and it's very easily visible. So even after a diagnosis of breast cancer, sometimes I cannot even tell those women even had a surgery, because the lumpectomy is so trivial. Sometimes it's side of the breast, under the breast, and I have to ask them. I said, okay, so have you had your surgery? And they said, yes. I said, well, I can't even tell. I cannot even tell. It's like so amazing. It's done, and it's outpatient procedure, sometimes done as quick as an hour, hour and a half. There's some women go home the same day. There is no overnight stay. They drive themselves for the surgery. They sometimes drive back, on their own. So it's really amazing how they can remove the tumor, how they can pinpoint a tumor that you cannot feel with your hand,
Right.
but based on the pictures, they are so accurate that where the clip is, you know exactly what they're doing. So the surgeons, have, of course, a big role to play in that. And we have several very good breast cancer surgeons in Tallahassee now, and some, do breast surgeries, 2, 3 times a week, 4 or 5 breast cancers. That's all they do, all day long, is breast cancer surgeries. And there's still some women who may need a bigger surgery. Not everybody, again, has a small tumor, and we still miss cancers. That happens. But for most of the women, they can feel good that they may not require a big surgery. They may not need all that reconstruction and having a lopsided chest, and having to wear prosthesis all their lives.
Okay. All
And
right.
advances are just as much in radiation treatments. Used to be a lot more brutal, lasted for a long period of time. Now there are shorter durations of radiation. The women come, and 30 minutes of laying on a table, where a radiation treatment can pinpoint where the tumor was present. So their machines can identify where the cancer was removed from and do some radiation around it. So that's the purpose of radiation. What the eye and the mammogram might miss could still be radiated with treatments that just burn a little bit around that area. and with very minimal, long-term side effects of doing that, and to ensure that the breast cancer is absolutely almost 99% gone.
Right. That's good.
And then the medicines that we use are, a lot of times we use medicines for breast cancer prevention. So some women who get a small breast cancer, there are medicines to prevent a future breast cancer. So like I said, just because a woman had one cancer does not mean she may not get another one, or there's a chance of cancer coming back. That's what makes cancers. One of the things cancers are notorious to do is to come back sometimes 6 months later, sometimes 3 4 years later. So we keep a very close watch on those women. We do more often testing on them, and we keep a check on them. And sometimes we can put them on a medicine, a pill that can reduce the chance of getting a future breast cancer. So they know they're being watched carefully. They're being overseen by a team of doctors regularly, at least for the first 5 to 10 years, and give them confidence that it's not like we remove the cancer and say, okay, bye bye. We'll see you again if you have a problem. We're like, no,
Right.
we'll watch on you. We're going to see you regularly. There is a question. They have a team to come back to, to report to us. And the women do get educated. We underestimate the awareness, what it does. They get educated about it, and like, okay, I knew what I need to watch for, what I need to do. I cannot take this lightly. I have to take it seriously.
Right. Okay.
So,
Yes.
it's October month, and usually I would be running around in some place doing some painting for breast cancer, or running somewhere, or putting your tux on and going to a gala to raise the money. We have been very limited in what we have been able to do, but that doesn't mean breast cancer has stopped.
Exactly.
There has been some concerns that for a few months, mammograms were literally put on hold last year, all over the country because of the fear of COVID. A lot of
Hmm.
times going to get their mammogram done. They were postponing it. So we did see a surge of breast cancer later part of last year after the mammograms were not done. Sometimes I think 2 or 3 months almost. They were, very 20-30% of them were being done. Some were being postponed by patients themselves, but they were worried. And I have to share with them that the breast cancer numbers have not gone down because of a COVID infection happening. There are protocols in place now. We are very well aware of how we can prevent women catching COVID infection. They get their testing done before they come for their surgery. So we're, all hospitals, including Tallahassee Memorial Hospital, is making sure we have all the proper precautions in place. So, last year again, we were all as doctors learning about this pandemic, and
Hmm.
everybody was worried that a risk of getting a COVID infection was more than the risk of breast cancers. And as we got more knowledge about it, we were like, okay, that's not stopping the breast cancers from happening. That's not, we think they're not happening
Exactly.
because they're not getting tested. And now everything, is better controlled, and majority of the people are getting vaccinated. People are back to doing their routine mammograms. I'm not missing it. And there was a little bit of a fear last year about what could happen by not treating some women or diagnosing them with breast cancer, when the pandemic was in the full blown, and women were scared to go anywhere for anything. So
Yes.
I give kudos to my infection disease doctors and COVID experts who have really made us confident into getting back and treating what we otherwise are treating. Car accidents don't stop. If
Exactly.
that happens. Yes, the car accidents probably did get less in number when nobody was driving around,
Hmm.
right? But they're not gone. They're not gone from here, and we have to keep the women have to keep their yearly screening, their month when they get their mammogram. They cannot let that pass because of anything else. If you're not
Exactly.
able to do a whole lot more, right? So you have to be there and to catch things soon. They may not need a whole lot of treatment, and some of them are done within 2 or 3 months, and then that's it. They're back to their usual self.
So, so have you noticed any any of your patients who have breast cancer who may have caught COVID, that COVID may have exacerbated any of the symptoms or any of the um, anything that would go into harming the body of a person who has cancer. If this person has breast cancer and COVID, how does that increase any of the negative effects of it?
Well, in terms of its negative effects, as we know, COVID infection affects the body in many different ways. For many people, it's just lungs and the respiratory system that gets affected, and their body's immunity may get weakened.
Hmm.
Any other infection. So we don't think there's any harm in the cancer treatment. We don't think that makes the cancers any more aggressive or vicious because of COVID infection. But women who are undergoing more aggressive treatments for breast cancer, like chemotherapy, they were certainly more vulnerable to have a more serious form of COVID infection. And we encourage all of them, again, to get vaccinated. We pushed back their treatments a week or two so they could get their COVID vaccination. But we did not see any harm to their body any more than the rest of the population, except for the women who were undergoing some aggressive chemotherapies might already be susceptible to any infection. If they catch COVID, certainly it was a bit of a challenge to treat, but knock on the wood, thank goodness, we did not see outcomes really change. They just needed more closer monitoring. We just had to warn them more and more, be extra safe, be more cautious, and encourage them even more to get their vaccinations done, um, so they so they're not going to be exposed to COVID or catching a serious form of COVID.
Okay. Cool. Yeah, because it was. I know that's one of the questions that I've wanted to ask, but I forgot to ask in previous podcasts. But I'm glad you're bringing it up here and that we could cover it because of the state that we are now. But as you stated, all of the other things that could affect the person's body negatively, like cancer or any other diseases or anything, they're not stopping. It didn't slow down because of COVID. And we, even in our field in HIV, we noticed that people really didn't pay attention to HIV anymore. Everything was COVID, COVID, COVID. But a person who has breast cancer is very susceptible and their body is weak at a weakened state. So if that person does contract COVID, it could have very, very, very negative effects. Um, but I'm also thinking about the advancements in the technology and the medicines. And because you talked about different medicines that are given to some of the patients. So are some of these medicines chemotherapy or similar to chemotherapy?
So yeah, definitely chemotherapy is one of the tools that we used for more advanced breast cancers or breast cancer that turned out to be more aggressive than we thought. But there's also a new class of medicines out there that's called targeted therapy. So for instance, about almost, I want to say, yeah, 20 years ago, they found a very unique protein present on some breast cancers called HER2, her as like her and his, HE.
Hmm.
So they found about 15-20% of breast cancers have that protein, and those women were found to have more aggressive cancer. But very quickly, with all the scientists getting together, they found a medicine called Herceptin that particularly specifically targets breast cancers that have that protein. So I mean that was, as an oncologist, that's like, wow, this like amazing. Found a protein that some women's breast cancer has, and very quickly they were able to find a medicine that specifically targets that protein that can be given with other medicines or without other medicines and really negate the bad effect of that particular protein. Similarly, a lot of women's breast cancer is estrogen positive, the female hormone estrogen. So we have a full box of anti-estrogen pills that we can give those women. So chemotherapy is something what we call as a more generic treatment that attacks cancer cells that are dividing and growing. It doesn't particularly pick one cancer cell over another, versus these targeted medicines like Herceptin specifically targets only those cancers that express that protein. Similarly, the anti-estrogen medicine only targets the cancer cells that express estrogen. So we test all cancers for these unique proteins, for estrogen, for progesterone, for the HER2. And if we find their cancers express that, we kind of really pinpoint our treatment on that particular type of breast cancer. So chemotherapy is like one amongst 5, 10 different treatments that we have in the tools in our box to treat breast cancer. And there's a targeted therapy, and there is advancements in immunotherapy that's been on for a lot of other cancers. It's sort of a little bit still in nascent phase, still in a research phase for breast cancer, but there have been some studies showing the women who have failed one treatment or second treatment and their cancer keeps growing or coming back, there are immunotherapies that can sometimes attack that cancers.
Right.
So, I mean, we have, like I said, we have so many different treatments that even a woman whose breast cancer has spread to other parts of the body, that does happen 1 in a 20, 1 in a 30 times. It's already spread to organs outside the breast, like bones or lungs. But we tell those women that that cancer is eventually going to take her life. We may not be able to cure it because it's not in the breast alone. But with these variety of medicines that we have, we can keep them feeling okay and alive, sometimes as long as 5 or 10 years, for what they call as a stage 4 breast cancer, stage 4 terminal and fatal. So I tell my patients, terminal does not necessarily mean next month, 6 months, 1 year. Terminal means eventually this will be how our life will end, but we could push it back by several years by employing and using all these different armamentarium of medicines and keep it in control for as long as we can.
Okay. So with that being said, if somebody is diagnosed at the terminal stage and they're taking the medicines, will a healthy lifestyle also help prolong their life in conjunction with taking the medicines?
Well, there's a balance in this. Some treatments are harder than others. So
Mm-hmm.
sometimes they may have a bit of a difficult time for first 2 to 3 months, and then once we shrink those tumors, then we can put them on something like maintenance treatments. They can perform most of their activities of their daily living and continue to go on, have a reasonable lifestyle. Any cancer treatment will affect their health and their life to some degree. So
Mm-hmm.
tell them that you may not be able to do everything 100% that you were doing, but hopefully 80 to 90% you should be able to continue to do what you're doing while you do these treatments for several years. And there's a balance of quantity of life and quality of life, so that's a discussion, each woman with the type of breast cancer and her oncologist sits down and comes up with a treatment plan. We're going to do this treatment for these many months, see how the cancer responds, then change it to an easier treatment that you can take on for a lot longer period of time.
Okay. Okay. Matthias, you had a question? Because I know we got to mute my mic so you can ask your question. I want to make sure. So, all right. So now this, because it's all fascinating to me. I love learning about the different treatments, and I love learning about the different medicines and the advancements of it and how everything goes in, because we've been taught so little about breast cancer. We've been taught so little about cancer as a whole. So I'm so excited to hear reiterated over and over throughout these interviews that cancer doesn't have to be feared the way it used to be in the past, especially breast cancer. It doesn't have to be feared. There are different ways to treat breast cancer. There are different ways to remove the breast cancer. And even if somebody says you have a terminal diagnosis, you can live. You can still live. That's amazing. But that's a testament and to the work that you've done and the other doctors within your field, other surgeons, other just all the doctors who come together. Because what we're learning from all of these interviews is when it comes to treating breast cancer, a team is put together, a total team. And you mentioned earlier, even the social workers are brought in to be able to add that extra element of helping the client be able to access the services that they would need. But so was this team that's put together, Is this something that has been created within the last 10 years or last 5 years, or has this always been a part of the process of treating or removing breast cancers?
Well, the concept of having a team is definitely new, because a lot of times back in the days, the surgeons will say, "Okay, I have removed this tumor. Now you go see the next doctor." And then the woman is like, "Okay, who do I see? What do I do?" Like, there's definitely this navigation services have come into play in the last decade or so of helping the women navigate our complex medical system. I myself cannot understand all the nuances that come, what the insurance is, where they work, how young
Hmm.
are the children. I don't always remember to ask them that. I'm focused on telling them about treatment. So this navigation team, they're helpful. They said, well, she has a 5-year-old who's going to pre-K, and we have to put that into the equation too. She cannot come on treatment on a Tuesday. She picks up her children that day. So this navigation team, is definitely a relatively new concept, but we at our cancer center have implemented that
Hmm.
all 10 years ever since we've been doing that here at TMH. And there is a team of navigation services. There includes a cancer navigator specifically for breast cancer that stays in touch with that woman, like what's going on. And she helps. We have a breast clinic in which we have a surgeon, a radiation doctor, an oncologist, the doctors who read the mammogram, and the doctors who read the biopsy. They all sit together and discuss each and every case as much as we can and come up with a plan that everybody can agree on. And then we go to the patient, where our navigator, social worker will go to the patient and say, hey, these are the doctors who were there in this room. This is what they discussed. And you don't need this or you need that. We're going to connect you with each one of them. And then we stay in touch with them, periodically over the
Right.
years. So they know, they're being given guidance. We don't say, well, you can do whatever you want. They're way old school medicine was, well, this is what you need. Then there was,
Hmm.
wherever you want. Now it's like a balance. Okay, this is what we recommend. Now, what do you choose between this? So women are given more power and more control over what they want, and they know that this team is there. So it's implemented at most cancer centers around the country to have a breast cancer team, including the navigation, social worker, dietary services, even what to eat, what not to eat during the time, before and after surgery. So it's a relatively new concept for cancer treatment, so to speak. But if you look at like the iPhone cycles, like the iPhone 12 is old. It's just a year old, but
Right.
right? So 10 years to me is still been there. Most of the doctors and like neighborhood medical center and places like that, they're aware that there is a team, there is a breast clinic, there's a breast cancer team available. We want to get the word out that there is a team, there is a collaboration of doctors and ancillary services with the social worker, case managers to help guide those women.
Okay. What questions would you recommend patients ask doctors to make sure that they are actually treated for breast cancer and they're given the best treatment as possible, and the doctor may not just dismiss it, but the doctor can actually take it serious and move forward on it?
Well, one good thing, I tell women, before I send them to another doctor or a different doctor, is to make sure that they go through a list of questions and write it down. First
Okay.
thing, you cannot possibly remember every single question when you're sitting face to face to the doctor. So it's important to know the stage of the cancer, so that helps them understand what are my chances. It's a good question to ask. What stage am I? The other good question I asked them to ask, so what are the treatment options? What could I choose between? Do I need surgery? What kind of surgery? Do I need radiation? Yes or no? For how long? Do I need chemotherapy for this cancer, or will I need chemotherapy? Well, is there a pill available? Is there a medicine that's, and then some real world question is, is there a cheaper alternative? It's a question
Hmm.
we're afraid to ask, but I sometimes I don't know everybody's full financial background. So it's an important question. Then women do not need to be afraid. There are medicines that might be a little bit different cost to them each month. Or what kind of diet do I need to do? Do I need to tell my family members, about this cancer? And It's a tough question to ask, but it's a good question to ask. Like, what is the chances I'm going to be alive 5 years, 10 years from today? You
Right.
know, seriousness of this cancer. Sometimes cancer, you hear, okay, this is it. So it is a tough question, but a very important. Even the women don't ask. I try to bring it up. Like, these are the chances, based on what we're seeing, and how likely that you're going to be alive and doing well. So asking these questions, writing them down on a piece of paper is the women who come a little bit more prepared, obviously, can understand better. If a question comes on later to the mind, feel free to call them up again. And if they're not sure what they want to do, it's okay to meet with their doctor one more time. Say, I want to understand. I want you to really explain to me different kinds of surgery, different kinds of radiation, different kinds of medicines. What do I need and why do I need this? Their compliance to medicine is better when they understand the purpose of it. There's
Right.
people that are out there, they take a medicine, and I have family members. I say, why do you take this pill? They said, I don't know. Doctor told me to
Right.
take it. I said, well, is it helping? I don't know. And so they may or may not take it. They're like, well, I don't know if it's working. I'm not going to take it. And I'm telling my mom, like, well, your vitamin D might be low. That's why he gave it to you. She's like, well, he didn't tell me that. And things can get missed. So the patient may not feel the seriousness of taking that medicine, or doing this certain treatment, if they're not aware and educated enough about it. Like, why are we doing this?
Correct. Correct. Okay. And I thank you for that, because we're big on making sure that our patients can advocate for themselves or have proper advocacy for themselves, because we want to make sure people are as healthy as possible, but they understand that you can take full control of your medical journey. And if you feel like you're not getting the best care possible, then you can go around and make sure you get the best care possible. Dr. Jan, I definitely want to thank you. This was a great conversation. This was great information that you've given us, and a great culmination to our series of podcasts going over breast cancer, getting it from different perspectives, and especially this perspective from the oncology hematology perspective. I definitely want to thank you. So um, once again, can you reiterate different places here in the Big Bend area, in the Tallahassee area, where people can go for breast cancer treatment, or even just screenings or learning about breast cancer?
I'm not familiar with all the different places, to be
Hmm.
honest. That we have at the Tallahassee Memorial Healthcare, or the Cancer Center, then the main hospital, Tallahassee Memorial Hospital. But this is something, the primary providers for healthy women,
Gotcha.
guide them to different resources, how to get education about it and how to know about it. They're welcome to call at we have a hotline at the cancer center. They're welcome to call to just ask about, like, okay, I feel this lump, what do I do? Or where do I get a mammogram done? There is radiology places. So there's different facilities that do that. I think, it's easier to start with their primary provider, with their neighborhood clinic or their family doctor, to know which is the easiest and most convenient way for them to get the mammogram.
Okay. And Matthias, how can people through neighborhood access mammograms or any other breast cancer screenings?
Well, here in the neighborhood, we would have to have them see our primary care physicians, and they'll be able to put a referral in for them to get a mammogram. Or they could either do the mammogram here with Neighborhood Medical Center. We can get it set up with Take Care X-ray, or we can refer them out to different places like radiology, CRMC, TMH, and different places around town that do mammograms. And our case managers can work with people who don't have insurance in order for us to get those mammograms and things covered through different programs. I think one of them is through with TMH.
All right, appreciate that, Matthias. And so, for all of our viewers, all of our listeners, everybody who's going to encounter this podcast, to learn more about Dr. Jan, and to be able to contact him, you can go, and I've learned this, tmh.org. That's where you can learn all the information about Dr. Jan and the various doctors who work within the realm of breast cancer or fighting cancer, period. And we want to give a grand thank you to Tallahassee Memorial Healthcare, um, Morgan, everybody who's helped to put these podcasts together. And we have more coming. We have more coming. So this is not the end, but we did want to make sure we focus on breast cancer, and we have more things coming because we want to make sure we utilize our platform to get information out. So thank you again for tuning in to another episode of Healthy Happy Hour for the month of October as we cover breast cancer awareness and breast cancer prevention. Um, Dr. Amit Jan, definitely a gem in our city. Great information. And make sure you guys check out this episode. Share it to as many people as possible. Um, Subscribe to the YouTube channel. Just tell a friend to tell a friend to tell a friend to make sure that they're taking their health as serious as possible, getting their screenings, getting their checkups, so we can make sure we live as long as possible. So with that being said, we'll see you guys next month on Healthy Happy Hour. I'm Joseph Ward. He's Matthias Sweet. Thank you again to Dr. Jan. We'll see you all later.